Amazing. This is a very good crowd.
It's an amazing crowd. From the ladies, let me hear, hey. You can do better than that. Let me hear, hey. Hi, ladies. Hey, acha tuone kama gentlemen.
Let me see the gents. Gents. Say, who? Say, ahu. Ahu. Gents are ready.
Gents are ready?
Yeah.
My ladies, are you ready?
No, let me do this, eh? I think the ladies want to hear from me. Hi, ladies. Ladies say hi. You see, they're responding better to me.
Gentlemen, I don't think I can do the aho like he does. Yeah? Gentlemen, aho. Aho. I think you're right.
Yeah.
We need to change a bit more.
Opposites attract.
You're right.
Thank you.
You're right.
So, ladies and gentlemen, my name is MC Tony. I'll be going along.
I go by the name MC Nina. It's an amazing evening, right?
Yeah.
And the guests look dapper. They look lovely. If you look lovely, say hi.
Okay, let's see if your friend can appreciate you. If someone is looking so good, just give them a high five and tell them you look amazing. Just give them a high five. Oh,
very nice, very nice.
If you see someone who is not giving a high five, just ask yourself, why are you not doing that?
There's people who are giving themselves high fives at the back there.
Okay.
Yeah, they appreciate. You know, love comes from within. You have to love yourself first.
Amazing.
Yeah.
Is that a high 5 or a high 10?
It's a high 10.
Okay.
It's a high 10.
Okay. Okay. So as we continue, we understand that, ladies and gentlemen, you know what we are here for? Do you know what we are here for? Do you know what we are here for? So we would like to request each and everyone kindly, before we start once again, kindly just rise up.
Rise up on your feet. Thank you so much. We'll start by appreciating our nation. We'll start by the national anthem, DJ Gads.
Thank you so much. Thank you so much. Do not sit down.
Do not sit down. Just
Don't
yet.
be in a hurry.
Do not say. Tunahitaji kuchangamka kidogo, right? Right? MC Tony, over to you.
I'm looking at these people and I feel like they're too official, a bit too official.
They look serious.
They look too serious,
They're
a bit.
very serious.
And we need to be a bit interactive. There's
Yes.
a chair that is just behind you. Just actually push it under the
forwards.
table. Just go behind that chair and push it under the table, kindly.
Make sure you have some space. Usigonge mwenzako. So don't hit your friend, don't hit your partner. Have some space. Have some space. To the left, to the right.
So as we do this, I want to see if you can interact with a few people. I know you might know at least 1, 2, 3 people in the house, but I want you to know a few more people. Is that okay? So make sure you get a partner. Everybody get a partner. Just get a partner.
Someone you do not know.
Even if it's someone that you're standing next to, let us find someone. Just make sure you have a partner. Just anyone. Just find a partner. Make sure you have a partner.
Pair up, pair up. Pair
So
up.
one partner. Remember, it's only one
A
partner.
pair. A pair.
A pair.
Pair up.
So, Nina.
There's a gentleman here who does not have a partner. Sijui tumtafutie partner.
Sijui, we give him the photographer.
Yeah, there's a lady over there with no partner. There's an amazing, beautiful lady over there.
There's a guy here with 2 partners. We
There's
only need you to have one partner.
There's a trio and we want to grow.
Kindly just get one partner. So, ladies and gentlemen, let me just advise you. Kazi ya MC, yani MC's work is a bit hard, so we would like you to join us in this program. Is that okay? Let us get a bit energetic. Let's make the occasion
interactive.
Is that okay?
Yes.
So what I'm going to request is that when you all have a partner.
Everyone has a partner. Who does not have a partner? Who does not have a partner? We are good.
Wilson is there with a photographer.
Yes,
okay.
Very nice.
So, as we continue, we'd like to request you, when I say 1, when I say, you give your partner a high 10. Okay? When I say 1, give your partner a high 10. 1, 1, 1. Okay. When I say 2, what you do is you shout out your favorite meal. Is that okay? If it is misheveve,
you shout misheveve.
Yeah, if it is ugali, you shout
ugali.
Is that okay?
Yes.
So when I say 2, let me try 2.
Misheveve.
2. I said shout it out. Is that okay?
Your favorite meal.
2. Amazing. Now I love the energy. So when we say 3, what we are requesting is that you shout out your name. Is that okay? So 2, you shout out
your favorite meal.
3, you shout out
your name.
Your name. Is that not my name? Your name. Your name. Okay? And then when we say 4, and find you with the same partner on the same spot in the same table, you're going to entertain us. Oh my God, you are going to entertain us. Yeah. So when I say 4, just go and get another partner. Shift as fast as possible. Wilson.
But come. Also, Mr. Tony,
yes.
If you don't want to move, it's good. People are talented here. They can show us their talent.
We shall see talent.
We shall see talent today.
I have Wilson here, wachana na photographer. So Wilson, your work is that everybody here has a partner. Your work is stealing a partner so that we actually get one partner who doesn't have someone. Is that okay? Just go and grab someone so that we are ready.
Now.
No, not now. No, not now. No, not now. So,
the preference?
Okay, about gender.
Choice is yours.
The choice is yours.
Choice is yours.
As long as you don't go to the photographers. Okay? So we are good? The rules are clear? Are you ready? So I want you to be a bit energetic. We get a bit energetic. Be a bit energetic. Let's go. 1, 1, 1, 2, 2, 2,
Shaveve.
3,
Wangare.
3,
Wangare.
3,
Wangare.
4. Okay. I think there's a team that has 3 people. So Wilson, you're the one remaining. You're going to entertain us. Wangari.
Yes.
The DJ is going to play something. Wilson, just go up. So the DJ is going to play for us something.
Yes.
Then Wilson is going to dance.
And then we are going to follow.
Absolutely. Ladies and gentlemen, if Wilson is the one who dances like this, we all do.
If he has 2 left feet, we all have 2 left feet.
Is that okay? Yeah. So Wangari, it's your time.
DJ, over to you. Please do. What about is not dancing?
Who does he sing it?
Ouais. Elle est à l'école. Round of applause for Wilson. Round of applause for Wilson.
He's a good one, eh?
That's a good one.
Wilson, the next one, kindly snatch someone. Now, try a bit harder.
Second chances.
We are giving you a second chance. Are you ready? 1, 1, 1. Kaa hapa hivi. Ndio you be. Yes. 1, 1, 2.
Mshaveve.
2, 2, 3,
Nina.
3,
Wangare.
3, 4, 4, 4, 4, 4, 4,
Wilson. Looks like Wilson. Wilson has a hidden talent, we can all agree. Wilson likes to dance. Wilson.
If we get you the next time, we give him a punishment. Is that true? A bigger punishment, eh? So, Wilson.
Alternatively, you can choose for us who you'd like. Who in your setting is a good dancer? No, you know your people better than we do. Who do you want to join you on this stage this evening? You either dance or you give us someone to dance with you. The choice is yours. You have the cards.
So let's do this, eh? He gives us a dance. Is that okay?
Yes.
Then after that, Wilson, if you don't do that, Mr. Director, kindly, we need him fired. He's not working hard enough to get some. Yes, yeah. We need him fired. Okay. Call who?
You can miss. The director is hiding.
Okay.
Director is hiding.
Okay.
The country director is hiding.
So we call the country director.
He's hiding. So call Silas.
Silas, who is Silas?
Very
Come
nice.
here, my friend. Come here.
Very nice.
Let's appreciate him as he comes
I
on
want
stage.
applause for Silas as he comes on stage.
Did he have a partner?
He had 3.
No, you didn't have a partner.
There's a point where they were 3, and then they became
Okay.
2.
So we start with him. So, Wangari, it's your turn.
Mr. Silas. Yeah, DJ. It's time for Mr. Silas to entertain us.
So we do as he does.
As he does.
Let's go.
DJ.
Nyamita! Omuruzuza gari mabulu. Rado. Ogila uye. Uba. Shumeki biro. Shumeki kusechiema. Wakni bela pekip kumana kipto. Ogela kwa juwija siara. Shimu moto biwa biondo. Ogela kwa juwija ngiapua. Shimu moto biwa biondo. Ogela baya pare verendo. Kosto nyaru speta kujo. Ogela baya pare sipna. Kosto nyaru fika mama. Ala. Wanya kastimari wiki. Nyarundo nyarundo.
Thank you so much, DJ. Thank you so much, DJ. Let's appreciate him. Okay, for one other time.
A round of applause for Silas. We've not appreciated him well.
So we go one last time. 1, 1, 1, 1, 1, 2, 2,
Rice.
2,
Chele.
2,
Rice.
3,
Wangare.
3,
Wangare.
3,
Wangare.
4, 4, 4, 4, 4, 4, 4. I see someone. I got her. I have her. I have you. Yes. Can you come? I found a very good entertainer. Kindly join us on stage. Let's appreciate her. She joins us on stage. Yes. This is the last entertainer. We leave. Do we have someone? Everybody hold your partner's hand and lift it up. Oh, whoa, there's a lady over. No, you're stealing someone. Wilson hatukutaki. So everybody has a partner, right? The stage is all yours. Wangari Gikunda will serve you. And then after that, we can go to the next part.
We can get into the program. DJ, what's your name before we get into it?
Agnes.
Very nice. DJ.
I want to flex my love. I want to press. I want to carry my love. You play shit up. I'm a woman. I want to press. I want to carry my love. You play shit up.
Thank you so much,
DJ, thank you so much, Agnes. A round of applause. A round of applause. You may now all have your seats. Thank you so much. You feel better? You feel better? Energetic? We can get into the next session, right? Absolutely. Right about now, I'd like to invite the tech team led by Mr. Wilson Matthew as we get into the 20 years of impact, where that we are here to celebrate HealthRight Kenya's 20th anniversary, right? Right? So Wilson Matthew and your tech team, the floor is all yours as you play for us the video of the 20 years of impacts.
HealthRight is an organization that is based here in Nairobi but working across the country, and our focus is really expanding quality health care services to the marginalized communities.
Founded in 2005 in West Pokot, we began with a bold vision and an even bolder action, launching a pioneering HIV program that led to a staggering 1,000% increase in HIV testing across West Pokot and neighboring counties.
We really focus around ensuring that we reduce the gap in terms of health access between the general population and also the marginalized communities. And we have actually been working across 11 counties, focusing on a number of key thematic areas. One, reproductive, maternal, neonatal and child health, RMNCAH. We have also had programs in other thematic areas such as HIV and TB programming. We've done work around violence prevention, especially sexual gender-based violence. We've also have a thematic work around mental health across the areas where we have been working.
It has been an amazing journey working with HealthRight Kenya, starting from the initial project when they joined the mental health space. And our first project was a very amazing project because it was an area that has hardly been navigated through or have projects going on. That was on perimental mental health, and this was happening in the informal settlements. So when you look at it, they are addressing an area that is neglected, and again focusing on women from the informal settlements, where we had amazing success stories from this project, and we were addressing depressive symptoms among pregnant and breastfeeding women.
Story yangu ilianza wakati mzee wangu alipoteza kazi, na mimi pia nilikuwa na mimba. Nilipata challenge mingi sana kwa sababu nilishindwa kulipa rent, school fees, na saa zingine pia kupata chakula ilikuwa ngumu. Na wakati mtu uko kwa situation kama hiyo, marafiki huwa wanatoroka, family members, unabaki peke yako. Nilikuwa najifungia kwa nyumba kwa sababu singetoka hata kwa majirani, kwa marafiki, sababu ya ile uoga, wanakusengenya, wanakuongea vibaya. Na sikujua kama na go through mental issues. Mpaka ule wakati HealthRight Kenya waliweza kukuja wakanitembelea, but mara ya kwanza nilikuwa naogopa ku open up, kuambia what I'm going through. Wakakuja mara ya kwanza, ya pili, ya tatu, sasa ndio nilifunguka nikawaelezea, but walinipa tumaini na wakanipeleka through 10 sessions zenye ziliweza kunisaidia, na through those sessions niliweza kupata skills, na nikajua kwamba hata kama mzee alipoteza kazi, bado kama mimi mwanamke naweza jituma na niweze kusimamisha familia yangu. Mimi nilianza kuenda kwa nyumba, nikafikiria, nikaona naweza anza kufanya nini ndio nijitoe kwa hii situation. Nikaanza biashara ya kuuza makaa, kuuza chapati, na nikaweza kuanza kulipa bills, watoto wakarudi shule, pia tukaanza kupata hata chakula. Currently I have an electronic shop. Pia niliweza kuhama kutoka kwa Slamu, saa hii nakaa nyumba mzuri. Nashukuru sana HealthRight Kenya, wamenitoa mbali, bila wao sijui saa hii ningekuwa wapi.
One of the key things that I must say is about the uniqueness of the work that we do, you know, as an organization. We truly, you know, focused at the community, and we're really very keen around evidence-based interventions. As an organization, we co-create solutions with our communities to come up with key evidence that does inform the programming work that we have been doing for the last 20 years.
In our county, the challenge has been poor health-seeking behavior among men. We really appreciate that when HealthRight came, their focus was on this target population, which is men, because of their poor health-seeking behavior. And over time, we've seen increase in numbers of men who are coming on forth to seek for services, especially HIV test services. We really appreciate that in 2022, when testing services was integrated with mental health, we saw the community benefiting from mental health screening and referrals. We saw uptake of men coming in for seeking services, especially HIV test services, and those who are at risk being put on HIV prevention interventions, those who are found to be HIV positive being linked to care and supported through mental health integration, through psychosocial supports. And we really appreciate that this became a game changer in terms of HIV programming in the county and finding men and adolescents.
Naweza penda hii mpango iendelee na isiweze ikituachilia sisi takuwa ni kama tumeisha. Kwa maana tunapewa vitu paka kwa mlango kwenyewe. Imetusaidia sana. Wanabodaboda wenzangu nawaambia tuendelee kushikilia hapo na tusiendelee kutoka nje sana bila mpira, na ndio hii shirika nimekuja paka karibu inatupigania paka hapo kwa mlango. Sasa tusiweze kutoka nje bila mpira.
HealthRight Kenya is a very unique organization in the sense that the rights issues around equity, reaching out to people who have not been reached, creating health justice with its programming is the main thing that it does, especially in the areas of mental health, which is currently a very big issue in the whole country and in the continent and even in the world. A very neglected area of care is what HealthRight does. In addition, maternal health, sexual reproductive health, all the issues around non-communicable and communicable diseases, which remain a big challenge in our region, are some of the issues that HealthRight Kenya is tackling.
Andres, umekuja unasaidia sisi kabisa. Unajua vile kazi ya kina mama, anapeleka kilini, napeleka tena mpaka nafuata mpaka napeleka hospitali. Mikindo hiyo shindomon abana mwanamke anasaa kwa nyumbani, anasaa kwa hospitali. Anaambia Andres, asanti. Na sisi anawana mabadiliko sana sana sana. Tangu akuje nasaidia sisi kabisa.
Appreciate HealthRight Kenya for what they have done in our county from the time we started partnering up to now. They have really impacted us in a lot of things that we have been able to benefit a lot. They have been able to train our health workers, and they have mentored them to have skills. And our community health promoters, they have also helped us in training them and providing them with knowledge and information so that they are able to help our community right from our villages.
To this end, as an organization, we have been able to impact more than 4 million Kenyans across the 11 counties over the 20 years that we have actually worked. We take pride and we are really happy about the innovations, life-changing innovations that we have really seen across all our programs. When it comes to the sexual reproductive health space, we have also had very useful innovations. We did work funded by FCDO in Elgeyo Marakwet and West Pokot. The contraceptive prevalence rate in those counties was very low, as it were. But we had to come up with innovations such as male involvement, ensuring that we are doing social inclusion, innovations that ensured that we can penetrate certain cultural barriers, and also address challenges both on the demand side and on the supply side to ensure that we can improve family planning in those counties.
Hapo mwanzo ilikuwa community ikisikia maneno ya family planning walikuwa wanaona ni kitu jambo hatari sana. Wanachukua kama family planning inaleta kanza, inaleta wamama kutokuzaa. Lakini baada ya HealthRight kukuja, tuliweza kupata hiyo information ambayo ilitusaidia, tukapeleka kijijini, kijiji waliweza kubenefit. Kwa sababu tuliweza kuwa na link nao kwa karibu, hiyo services ikafika kwa community. Of which tukakuwa trusted sana. Kwa sababu kuna wamama ambayo walikuwa wakienda na hofu. Wasee wao hawakuwa nakubali maneno ya family planning. Lakini baada ya sisi kupeleka hiyo information kuwa family planning haileti cancer, family planning haisuii wao kupata watoto. Inafanya nini? Inafanya tu child spacing. Mtu anaweza kupata watoto ambaye anahitaji ama anapata mtoto kwa muda fulani.
Wamama wamerelax, alafu pia wanazaa kwa mpango ulio mzuri. Maana hapa awali kabla wajue, mama alikuwa anazaa baada ya mwaka. Sasa afya mama inadhoofika, hata watoto ambao wanazaliwa pia hawana afya ile nzuri. Lakini sasa hivi baada ya miaka 3 ama 5, bila shaka yule mtoto akizaliwa, yule mwingine amekuwa mkubwa, afya mama naye ni safi. So kutokana haya mafundisho ambayo tulipata kwa HealthRight, mimi kama kanisa nilifaidika na nilisaidika sana, na jamii wengi wamekuwa kipongeza na hata wanaulizia haya mafundisho yameenda wapi.
And it's so amazing these days when you go for support supervision and you find a community health promoter who is running these interpersonal therapy groups without being paid, and that shows that from what they did, there's a big aspect of sustainability.
I recall when we started with HealthRight way back 2018, 2017, when we were doing less than 40% prevalence for family planning services. But when HealthRight exited by the year 2022 to early 2023, our performance stood at 59% coverage for family planning contraceptive services in this county.
As we look ahead, we recommit to our core values: innovation, equity, and a human-centered approach, all in the pursuit of increasing access to care and increasing care quality.
I really wish to thank all the many partners. I celebrate the community health workers we work with. I celebrate the youth and the champions in universities that we have been working with. I celebrate the HealthRight staff who are the front line when it comes to programming within the organization. I appreciate the support we receive from our headquarters. Thank you, universities, for trusting to work with us to get solutions to the challenges affecting young people as well. To the Minister of Health, we also say thank you for creating an enabling policy environment for us to be able to roll out quality interventions that can be able to address public health challenges in this country. And for the county governments for being with us there during implementation, providing the technical support. We really appreciate that kind of invaluable support. To our partners, we'll continue working together, and everyone else that has really made these 20 years worthwhile. And last but not least, it's the funding community and our donors. Without the financial support that you gave us, donors such as USAID, FCDO, Gilead, Comic Relief, and several others such as Amplify Change that I may not mention all their names. Thank you so much for your financial support that came our way and enabled us to be able to support the lives of millions of Kenyans in terms of accessing quality health care. Thank you so much.
applause for that amazing video of the amazing work that HealthRight have been doing for the last 20 years. I must admit it is a privilege to be in the presence of the good work that HealthRight Kenya have done for the last 20 years, right? Right? A round of applause for them as well. We are here to celebrate HealthRight Kenya, so it is only right for me to officially invite the country director, Benson Simba, to officially invite us to this auspicious occasion. As he's getting on stage, a round of applause, and DJ, give us something.
Wangari, don't you think he's a bit too serious?
Yeah, I know. I was waiting for him to get here first,
Yes.
as he does not change his mind along as he goes back. I know that this is your boss, but all protocols observed. With your permission, I would love your boss to dance for us, right? Right? For all those who support this, say aye. DJ, give us something. DJ, over to you.
You're very lucky because it was easy to give punishment to sailors, quote unquote, because was that Silas or Wilson? Now you have no choice. Yeah. So I don't know another boss to tell you to. So thank you so much. Good evening. I'm really excited and happy to see all of you here today. As HealthRight, we're really humbled by your coming here and for taking your time to come and really share with us this moment. It sounds like a birthday, right? Yeah, to come and share with us this particular moment. And by the way, I know we've talked about the many people that we celebrate. But I think for me, what touches me most, I mean, we all know what WHO says, that every 2 minutes, a woman dies from preventable causes related to pregnancy and childbirth. Every 2 minutes. So some of you guys came here at 5. So if we were to literally start counting how many women we have lost since then, those are not just statistics, right? So we're literally here to celebrate, the lives of many people that have been saved all along in their 20 years. So it's really a celebration. And I think since for me I've done my bit of dancing, so as we continue celebrating, more other people, there are people I want you guys to call here to also, get to dance. So before I really proceed, I just want to appreciate the presence of the Deputy Vice Chancellor of the Management University of Africa. I also want to appreciate the presence of the Global Chief Executive Officer of HealthRight International, Professor Peter Navario, the Chairperson of the HealthRight Kenya Board and Vice Chancellor of AMREF International University, Professor Joachim Osur, distinguished representatives from different universities who are a part of us here, our esteemed development partners, and even colleagues from the Ministry of Health. Ladies and gentlemen, good evening. Good evening once again. I want to take this chance to really appreciate the founders of HealthRight, because 20 years ago, when HealthRight came to Kenya, then as Doctors of the World USA, they went into the remotest part of this country. And I think there's something about us that sometimes we choose where things are a bit easier. But the founders of HealthRight, Doctors of the World, they chose to go to the most remote parts of this country in West Pokot. And for some of us, how many have been to West Pokot before? No, if you came from there the other day, excluding Peter who went there. So how many of us have actually gone to the parts of West Pokot and seen what's happening there? Yes. You see, we are about 10% of the team that is here. So really, once you go to those communities, that's when you deeply appreciate the need that is there. So HealthRight went deeply into the marginalized parts of our country. And they went there to bring hope, and they went there to bridge the gap between, the health inequity, the gap between, health access between the general population and also the, those marginalized communities. And we have been doing that for the last 20 years. It's never easy. And in a situation where we have even organizations folding up along the way, it's been a journey, it's been learning, it's been making milestones, and there have been a lot of hard work along the way. I think there is an African proverb that says that if you want to go fast, what should you do? You go alone. But if you want to go far, what should you do? Go with others. Are we together? So in that journey, we kept on working together with the government of Kenya. We kept on working together with the community. We kept on working together, with the development partners. We kept on holding each and everyone's hand as we walked down the journey to be able to, support those communities. So I think for me, as we have this evening to reflect, it's really to think about the lives that we have been able to promote, to prolong, to save in the process of the work that we have been doing together. The community health workers that we kept on working with in all these programs, be they the HIV programs, be they the mental health programs, they're the true heroes that we also celebrate in this room. If I had a chance, I will bring more of the community health workers than those of us who are here in the city. For good reasons, because they are at the front line doing this work day and night, literally supporting the communities that are marginalized. And as you can imagine then, the community health strategy was still evolving. Things were kept on evolving over time until where we are here today. So they're the true heroes that we also celebrate, in this place. But even as we have these reflections, we know that a lot more remains to be done, even as we move forward. So I will challenge us, even as we think about the good days that we have had, as a community that is working in this space, I will challenge us to reflect also on the many challenges that we still have, in the coming days, areas that we have emerging challenges in the health sector, for example. Climate and health remains a major challenge to deal with as we speak right now. Literally, health has become the face of climate change, as it were, as a crisis. And there's several other challenges that really that are on our way that we need to keep on reflecting to be able to innovatively get to address. So my being here is to really welcome you to this event, to share the successes we have had together, to reflect together about the future, and genuinely feel most welcome, to this event, to also share with us this joyful moment and the milestone that we are making, at a time such as this. So thank you so much, and may God bless you as you continue engaging this evening. Thank you.
Mr. Simba, do not leave the stage. We would all want to know, who is this that you want to punish this wonderful evening? You said you want someone to dance. So we can mark them.
I want her to dance because she made me dance. So I want her now to dance.
Right now or after?
After.
After,
yes.
Absolutely, I agree.
Yeah.
A round of applause for Mr. Benson Simba. Thank you so much for welcoming us. Do we feel welcome? Do we feel appreciated? Another round of applause for him as he leaves the stage. Right about now, we'd like to get our recorded speech from the HealthRight Kenya Board Chair, Professor Osur. Our tech team would like to get the speech from Professor Osur.
The PS Ministry of Health, our board members led by our colleague from the US, Peter Navarro, invited guests, our donors, our staff, ladies and gentlemen. It gives me great pleasure to welcome you to this very important function that we are having. It has been 20 years of great work by HealthRight Kenya. We have met needs of communities, we've collaborated with governments, we've received significant amount of support from our donors. I want to thank you on behalf of the board for all that work that we have done together. As we do this, we realize that we still have problems as a country. In fact, one of the areas that HealthRight has done a lot of work on is on mental health. But mental health is getting worse by the day. We now have more femicides than ever before. Suicides continue to be a problem. Now, these are the extreme ends of mental illness. There are many, many other milder cases of depression, of anxiety, and many other forms of mental illness. So it remains a big problem in our community. We've also done a lot of work around maternal health, but we are still not out of the woods. Mothers still die from preventable causes. We still have preventable morbidities in our health facilities and in the communities. And so we realize there is still a lot more to do even in that area. HealthRight has also done a lot of work around communicable diseases, including HIV, and we still have a lot of cases of these diseases. And even the health system, which is very important in ensuring that we have equity in access, that everyone has the care they need, that quality is acceptable, still remains a challenge. And therefore, as we celebrate, we do recognize that the work is still there and a lot more needs to be done for the health of every community, every Kenyan that we touch to get quality health and to live longer quality lives. And therefore, we will continue to collaborate. We want to continue working with the government, and we request that you continue the support that you've been giving to us. We want to thank our donors and request that you continue supporting the organization. And we want to thank the communities that we work with and continue to request that we partner and get the solutions together for the problems that the communities face. So going forward, we want to thank you and we want to ask for more support, even as we celebrate the many achievements and the challenges that we've gone through and survived to date. Thank you very much. Enjoy the celebration. Asante sana.
A round of applause. Thank you so much. That was HealthRight Kenya's board chair, Professor Osuru. In his absence, we appreciate the role he is playing in ensuring HealthRight Kenya is running smoothly and continually impacting lives for the marginalized in our country. Right about now, I'd like to welcome the HealthRight International CEO, Professor Peter Navarro. The stage is all yours. A round of applause as he gets on stage.
Personally.
I use this one, not this one. This one. Does that one work?
Yes.
Oh, perfect. Okay, so I can get this one. All right, thank you. Good evening. It is a pleasure to be here with you tonight. Not only are we celebrating HealthRight Kenya's 20th anniversary, but this year is also HealthRight International's 35th anniversary, so lots to celebrate. HealthRight over 35 years has worked in more than 30 countries around the world, and as you've heard tonight, we've been here in Kenya for 20 years. I've been CEO for about 11 and a half, which is very difficult to really sort of get my head around. It's gone so quickly. Let me start by, and so I just wanted to say it's wonderful to be here and celebrate, even though this is in many respects a difficult year to celebrate the work of NGOs. It's a tough year, but I think if if there's an NGO who has the staff and the mission and the board to succeed in a truly trying environment when the need is greater than ever, it is this group, and I have the utmost faith in the HealthRight Kenya team, and I'm proud to be part of this team. Let me start by welcoming all of you, the DVC from the Management University of Africa, Prof. Osor, who just greeted us, Benson, our country director, distinguished representatives from our partner universities, our esteemed development partners, colleagues from the ministries, from the Ministry of Health, and distinguished guests. Once again, good evening to everybody. I had some prepared remarks, but I'm actually going to pivot a little bit, and I'm going to, you heard a little bit already about the incredible work that HealthRight Kenya has done over the past 20 years, from the establishing of the very first comprehensive care HIV center in Kapenguria, to increasing the uptake of HIV testing in West Pokot and much of the North Rift. That's really where our work started in the early 2000s, through to our work in reproductive health, and the increase in uptake of family planning services in Elgeyo Marakwet and elsewhere. And you've heard about our maternal health work, and tonight you're going to hear a little bit about a exciting new initiative called Minds in Motion, which we're really excited about. So there's a lot to celebrate, but I want to tell you a story about one of our projects that's been running for about 6 years that I think really embodies what is remarkable about the work of HealthRight Kenya. And I think it really describes a lot about the ethos of the work of this organization, and it tells you a lot about how we believe our work changes people's lives. So I'm going to tell you the story of the Sako Health and Wellness Project, which started in the North Rift in Trans Nzoia County. This project, I think, from just principles around increasing access to healthcare services and improving the quality of those services, through to how we connect communities to the primary care system, are really encapsulated in this project. This project is a partnership that we created between the Boda Boda Sakos in Trans Nzoia County, so the Sako membership, the county health management team, and the community members themselves. So when you look at HealthRight programs, you will see these three key elements. We believe that if you design interventions that touch these three things, the community members, the community structures, and the primary care system, and your intervention is building the capacity of all three of those three legs of a stool, your intervention has a real shot at sustainability. And this project does that. By building the capacity, creating health and wellness champions within the Sakos themselves, and supporting the elevation of a health and wellness officer within the Sako leadership. We've created internal demand within the Sakos for, frankly, any healthcare program. This program started out to try to engage the members of the Sakos, almost all of which, as we know, are men of reproductive age, to know their HIV status. And that's really how the project started. We were trying to get men engaged in healthcare by getting them to know their HIV status. We partnered with the county health management team and the primary care system in order to provide test kits and critical information and other commodities to these testing campaigns. We worked with both partners and community-based organizations to run testing events on a regular basis to attract people and to help them to know their status. Really, the goal was to get the Boda Boda drivers and their membership in, and we've tested tens of thousands of people in a model that, as you likely know, is replicable across sub-Saharan Africa. There are Sakos in every country across sub-Saharan Africa. This is a replicable model, and once set up, it is a model that can run without our direct participation. All we've done is creatively linked a community structure, the Sakos, community-based organizations to the CHMT, and communities themselves. And this project now not only screens people for HIV, but we screen and refer people for common mental health disorders like depression, PTSD, and anxiety. And now we are looking to expand this to include screenings for things like cardiovascular disease, hypertension, high blood pressure, et cetera. So I wanted to tell you the story of this model. And by the way, we're in the process of launching this project in all of the sub-counties across Trans Nzoia. So we've covered the whole county, and we've launched this program in Uganda, in Lira City as well. So we're replicating it elsewhere. I think that I wanted to tell you the story of this model because I think it really encapsulates, again, access, designing things that are community-driven, community-owned. And as you've heard from other folks already tonight, and you saw in the video, integration across mental health, HIV, and other health issues is critical. The siloed approach that's been sort of the norm for the past how many ever years in global health and development, I think we all agree, needs to give way to an approach that is fundamentally about integration and strengthening primary care systems. So with that story, I will just say congratulations to the HealthRight Kenya team. Again, welcome to all of you. Thank you for joining us this evening for this important celebration, and we hope to have the opportunity to work. We thank many of you for working with us already, and we look forward to working with others in the near future. Thank you very much.
Thank you so much, Professor Novario. We appreciate your efforts and your inputs in the impacts being seen at HealthRight Kenya. Another round of applause for the amazing work he's doing. Right about now, I'd like us to get into the next session, which is the keynote address. This keynote address will be run by the DVC, Dr. Kathula. A round of applause as Dr. Kathula comes on stage. DJ. I don't know if either you'll go down the stairs, then you come up dancing, or you'll dance for us here. DJ. Welcome, Dr. Kathula.
Yes. All protocol observed. Good evening. Good evening once again. I'm so delighted today to be the one to give you the keynote speech. I'm sure you are aware I was not the one to give, but because our PS got unwell and he had not sent the speech to be read. And why I'm giving you this keynote speech is because I have the privilege to be here. The county director, Benson Simba, is my alumni. I am the DVC, Management University of Africa, which is just a stone throw. We are just a kilometer from here. And we are proud because what we produce when they go out, we can see the kind of county director we are having. Am I not happy? Yes. So, and what they are doing is also passion in my life. I'm a biology teacher. And you know biology we teach about HIV and AIDS, reproductive health, maternal health, and all this. And where I teach, even currently, I teach HIV AIDS as a unit. And currently you have also seen, like before, where HIV and AIDS was being tested, excluded with, or exclusive of the tuberculosis. Currently, we have seen tuberculosis is the most co-infection under the bacterial diseases, which are usually co-infecting people with HIV and AIDS. And that's why you find when you get tested for HIV and AIDS and you are positive, you are also encouraged to be tested for tuberculosis. If you test positive for tuberculosis, you are also being encouraged to be tested for HIV and AIDS. And the statistics is having it that more than a half, or more than even 50%, who are testing HIV positive or tuberculosis positive, they are also HIV co-infected. And we are also learning that people get to know when you have these two diseases in you, you give preference to tuberculosis because tuberculosis is curable But HIV/AIDS, you are going just to manage this the rest of your life. And when you are getting these drugs, the ribavirin for tuberculosis, the ARVs for HIV and AIDS, they usually bring that pills burden because you swallow many of them, and you find sometimes because of the side effects, people sometimes want not to adhere to the treatment therapy. I'm not teaching you, although I'm a teacher. So what this organization is doing is very core in our country, because in our rural area, some of this information, they may not be getting it. Rarely do they read the newspaper. Rarely do they get it in the social media, like in the TV, like those most of us who are in our town are privileged. So it is only when we have this support of the community health workers to go and educate them through the women groups, the youth groups, during the church function, that the informations get to them, so that they can go and get tested to know their serology or to know their status. I'm sure you have also seen the statistics being shared in the social media, that most of the people giving birth to children with HIV and AIDS, they are teenagers. Why are the teenagers giving birth to children with HIV, yet the grown-ups and the married people are not giving birth to children with HIV? Because most of the grown-ups, when they reach 3 months of pregnancy, they will go for antenatal clinics. And as a government rule, when you go for antenatal clinics, you'll be tested for HIV/AIDS with or without your consent, because a government rule to try to minimize the transmission from mother to child. But the teenagers, what are they doing? They are first hiding this pregnancy. They don't want to be discovered they are pregnant. So by the time they are going to the hospital is when they are giving birth. So when an organization goes out to reach these people, to encourage them to go for HIV testing, to go to clinics, they will get to know their HIV status, and then they will be counseled and get introduced to the treatment therapy so that they are able to prevent the transmission during pregnancy to the fetus or giving birth. I'm sure most of you are aware. If you are HIV positive, you are given optional cesarean section so that the baby can be removed safely without being infected during the process of giving birth. And then you are not supposed to breastfeed. So the knowledge and the information reaching the right people in the rural area is what this organization is doing. And I'm sure it's an organization we all need to support so that they can reach and pass this information to all the people. The issue of maternal health and even mortality rate is still high in the rural areas, because most of them, they still don't go for hospitals when they are giving birth. And imagine a child presenting themselves with the legs. That is death to that mother, if that mother is giving birth at home. Unlike when they go to the hospital where an emergency cesarean section can be done. And that is information is what this organization is doing, and that's why we need, as a country, as NGOs, we need to support this organization. Reproductive health is not that people get to be taught reproductive health because of either avoiding to become pregnant and all this. Reproductive health is very important. I'm sure most of you know the sexual transmitted diseases. Some of them, they are not sexually in nature, that you did sex to get this disease. If you have bacterial vaginitis, not that you did sex. If you have baladine as a male, not that you did sex, because probably it's our culture. If you are from those cultures where you don't get circumcised, obvious anytime you urinate or even you wash, you are always wet. If you don't pull back the sheath to wipe yourself, you are always wet around the reproductive area, and then you get baladines, hence exposing yourself to HIV and AIDS. Girls or women, if you stay with pant for more than hours, which are required because either your flow is low, at the end, what do you get? You get candidiasis. You start feeling irritation when you are urinating or some pain. And you fear to go to hospital because you think you have been infected by sexual transmitted disease. So this information of reproductive health, which the organization is doing to get the women, to get the youth, to get the men to know the importance of reproductive health so that you can be able to prevent yourself from getting this disease. And if you find that you have these diseases, what do? You need to do the treatment. so that you don't expose yourself to HIV and AIDS. So what we are saying, the HealthRight Kenya is doing something which most of us need to support, because this information is very important for our young generation, for ourselves. Issue of mental health. I'm sure most of you know somebody who is mad. You may think you are all right, but even yourself, you are mad. When you go to the bed and you cannot sleep, you cannot get sleep, what is making you not to sleep? It's because something in your mind is disturbing you. So that may result to distress, to stress, and then most of you have teenagers, and you can see the rate where young boys and girls are becoming mad, simply because of substance abuse. And since they cannot afford the legal drugs, what are they taking? They are taking marijuana, they are taking caffeine. Bangi is the #1 cause of the insomnia the children are having. If you trace any madness in the young generation, they will all confess they have taken bangi. Because with 30 shillings, you have bangi. And you feel high. And currently you see the way they are smoking bangi like as if it is a tobacco or cigarette. And that is where we are as a country and as parents. So when you think you are safe, because either you are not struggling, that is not right. Go to universities, I'm sure you are seeing also the statistics, where the students have just gotten, because of stress, they have gotten into drugs. You think your child is there learning, and they are not learning. You are paying fees, I'm sure most of you have heard these stories. Parents getting disappointed after 4 years, they are ready to go for graduation, only to be told their son or their daughter is all the way back in second year. So issue of mental health and issue of substance drug abuse is something we all need to tackle. Not that you can say, for you don't have it, because you never know, because this is not, mental health is not discriminatory, and also even in our families. So with that few opening remarks, I want to say the HealthRight Kenya need our support, need our advocacy, need us to champion their call and also to support them so that they can get the much needed funds. Where you are available and you have this technical knowledge, provide that training whenever they are having these women. You can see the kind of examples, the kind of the people they are reaching. The vulnerable in our community, the poor in our community, those who need the information more than us, who can get it through our television, through our newspaper, through our radios. So let us support their cause. Let's stand with them. And through that, we are benefiting our country and we are benefiting ourselves. Thank you very much for giving this opportunity to me to give you this keynote speech. Thank you.
Thank you so much, Dr. Kathula. Dr. Kathula has really taken me back. When I was in high school, my favorite subject was biology, followed closely by mathematics. So for being a biology teacher, help me give her a round of applause. So right about now, we're gonna get into a little break as I request the team here to move the podium as we prepare for the next panel session. Can I get the team to move the podium as we prepare for the next session? In the meantime, MC Tony.
Ladies and gentlemen, hi. Hi. Hello. Kindly stand up, just stand up, let's stand up. Mine is standing you up each and every minute and making sure that you're not bored at all times and everything. Is that okay? So kindly let's just stand up. Always push the chair behind you under the table.
To the front.
Let me see your hands like this, your right hand.
Stretch a bit.
Your right hand. Your right hand. Let's see your left hand. Okay. Let me see. Now, I want you to do for me this. Put your 2 hands to the front. And then I want you to call 3 times. 1, 2, 3. 1, 2, 3. I can't hear you. Let me see. 1, 2, 3.
1, 2, 3.
And then 1, 2, 3.
1, 2,
and then
3.
you go down 1, 2, 3.
1, 2,
and then
3.
clap your hands. 1, 2, 3.
1, 2, 3.
Are you ready? So you do as we do. Is that okay? So our DJ, you can play for us some music as we continue. Let's go. Now let's go together like this. Now a bit faster. Now you fetch it. Let's go. Let's fetch. Let's go now. Now you dance like this. Turn with it around. Turn around with it. Let me see you turn around. Now let's see. Let me see faster. You're tired. Are you good? So as we continue, I would like now to take it back to Wangari. Then we can go to the next part.
Thank you. I've left my program on the table.
I can get it for you.
Thank you. The other one. Thank you so much, MC Tony. A round of applause to yourselves. Mejarib, you've done a good job. You've done an amazing job. Right about now, I'd like to welcome Madam Hawa Abdullahi. She is the program regional programs lead. She'll get us into the next session, which is the reflections, the partner reflections. DJ, give us something as Madam Hawa comes on stage. Let's applaud her as she comes on stage. You're welcome, Madam Hawa. Over to you.
Good evening, all protocols observed. Gen Z wako kwa nyumba. Gen Z wako kwa nyumba. Gen Z oe. Ai, maandamano hivyo ndo tulikuwa tunafanya. Gen Z oe. Ai. Sawa, the old people oe. Everyone who's not a Gen Z is an old person, bana. So it's my pleasure to be here with you today, and I would wish to invite our colleagues. Number one, the partners. Of course, as we celebrate 20 years of impactful service, we would wish to have our partners here with us today, just so that we can better understand what about their partnership with us worked, how our collaboration was able to influence the communities, and looking ahead, the hopes and aspirations that they have for us for a continued partnership. So at this point, I would like to invite Dr. Martin Mushangi, Population Health and Environment, and Josephine Mbiu, the Global Public Health Specialist. Thank you so much. Dr. Martin Mushangi. Okay. Maybe at this point then we can have get to have we can get Jamros champions. Okay, then we can get the champions, the mental health champions. Rispa and Dennis.
Good evening. My name is Rispa, a mental health champion from Mukuru. My case started when my husband lost his job and I was pregnant. Life became so difficult for my family because I was unable to pay rent, school fees, and sometimes getting food was hard. But I thank God and I thank HealthRight Kenya because they came along. I lost hope. I even wanted to terminate that pregnancy, but I didn't have money. But HealthRight came along, gave me hope, and took me through 10 sessions, which really helped me. Because through those sessions, I got skills, which helped me to go out there and start business of selling charcoal and chapati. But currently, I have an electronic shop, and I even relocated from the slum to a better house. I'm here today sharing my story with confidence, and I'm proud because without HealthRight Kenya, I don't know where my life could have been right now. They have mentored me, and I'm also mentored out there in church, in some small groups, and even I have mentored my friends because through my story, I'm sharing out there with others. They saw me, those who were seeing me before, and right now, they see a change in me. And through what I got from HealthRight Kenya, I'm also sharing out there. I thank you, HealthRight Kenya, because I'm also a mentor there, out there. And also, through the skills I got from HealthRight Kenya, I also joined St. John's Ambulance. Right now, I'm a trained first aider, and I'm ready to help the community out there. Thank you, and be blessed.
Thank you so much, Rispa. We thought it was necessary for you to hear from our honored beneficiaries. And Rispa is a beneficiary especially for the Maternal Mental Health Project in Mukuru Kwanjenga. And so, because we cannot hear from the beneficiary alone, we also have a community health promoter who's in charge of the sessions at the community level. And kindly, Dennis, take 2 minutes to explain to us what you do and how it has impacted your life and that of the community that you serve. Thank you.
Thank you so much. I'm Dennis Otieno, a community health promoter from Madare. Madare is in Ruaraka sub-county. So as a community health promoter, we do door-to-door screening where we screen on mental health. So after screening, depending on the magnitude of the stress or depression, we refer them for psychosocial support. Then after that, depending on the situation, we also enroll them for the interpersonal group therapy where they share different problems as a group of 10. They share different problems. They hear from each other, share different problems, learn different coping mechanism, how they can cope with the stress. Then after that, after the 10th session, most of them probably heals. For those who the magnitude is high, who may be attempting to terminate their life, they also enroll them for psychosocial support. It has been a very good. It has a very good impact because most of the perinatal mothers didn't know that they are going through depression. So after enrolling them into the group sessions, most of them heals, and it has created a great impact because this is one of the evidence-based intervention. This is one of the evidence-based intervention where you hear from the horse's mouth. Thank you.
Thank you very much, Dennis. Of course, it helps when you get to hear from the health promoters and also the beneficiaries of the program, because then we get to hear their voice. It helps us understand what exactly they are going through and some of the challenges that they're encountering even during implementation. And I'd wish to also just give Stella from the county an opportunity to make a reflection on her part.
Thank you so much. Good evening, everyone. Good evening. I know we are all tired. So my name is Stella Waringe. I'm a mental health expert. I see he's smiling. I think sure he had not seen me. I lead mental health and psychosocial support in Nairobi. Why I just needed to put my voice in this, because for us as a county, this was the most, in my 8 years leading mental health, this was one of the most effective programs we have done. The only program that we have had that is coming and targeting perinatal mental health. Perinatal mental health is, we talk about perinatal period from pregnancy to childbirth, up to 1 year past childbirth. And we all think as Africans that once you get pregnant, you're happy, you deliver baby, we go do baby showers. But to most of the mothers, especially where they come from in the informal settlement, they have so many predisposing factors. Key among them, intimate partner violence, socioeconomic status where they're struggling for their upkeep. And you find that also they're dealing with substance use and also Africans' gender preference. So one of these programs, what we did is that we were able to implement what we call interpersonal therapy in groups, which is a WHO accredited low intensity psychotherapy. And why I'm proud of HealthRight, they came and used the county structures. For me, I'm a master trainer in IPTG. We train county people and we train them, the CHPs, who are the doctors. We call them madaktari wa kijiji. So what happens, and why I'm usually excited about this project, is we're talking about donor funding cuts. And this is one program that has proved that once you do capacity building at the community level, you're building sustainability. If you go to him now when the program is not running, go to Mukuru or go to Mathare North, you will find the CHPs running groups on their own without being funded, without being paid. You will find them doing work that is not HealthRight work. So I think when we talk about sustainability, as an organization and other partners who are seated here, when you want to support a county, number one, support the systems. We have had success stories. It is those three programs when I was being trained to be a trainer by our master trainers. I remember one of the time when I was being trained, I had to go to Pumwani and recruit mothers and take them through IPTG and get supervised. On my 4th session with one of the mothers, she told me, Stella, unakumbuka ile siku uliniongelesha? I can only say it in Swahili, then please interpret Simba. Hiyo siku nilikuwa nimeamua nitajiua na niwe watoto wangu. Because she was dealing with HIV, she had a small child, and the elder one had just been diagnosed with HIV at 4 years. And the husband, who was a stepfather to this child, was raping the first daughter. But by the time we were finishing 10th session, that woman, we were even telling her to keep quiet in the group. She was the most loudly laughing, encouraging others. And the most of it with this project is that they come at their lowest. And by the time they are finishing, and she's a very good example, they used to do income generation. They teach each other. Because with interpersonal skills, we teach them, number one, we want to address depressive symptoms. But again, we are not giving money. How do they help each other? They used to say, me, I know how to make soap. We can teach you how to make soap. They used to contribute 20 shillings. They get money for giving one of them to start a soap business. They contribute and someone else said, you can be selling, you know what we call viazi karai. But I don't have capital. They would contribute 10, 20, and they build each other. So I think for me, HealthRight, where I have even come from, where I've come, is just to tell you, thank you for this project. We hope we can have more, but even what you've already planted, we have trainers, we have the community health promoters who are not moving and doing it. It has been, and when you hear it from her, and she can tell you, I wish you played that story, the video that we did, and you hear it from these women from the low informal settlement talking that I wanted to kill myself. I was given up in life because of depression. And out of that intervention, I went back to my husband, I started doing businesses, and I'm able to take care of my child. Thank you so much, HealthRight. God bless you.
Thank you so much, Stella. And we've had this before, and we've had it also today. The real heroes out there are the community health promoters. Of course, we recognize that without them, we'd not be able to achieve much. As a team in this room, we are very lean. We actually depend on the large number of community health promoters who are not paid, by the way, until recently, and it's just stipends that they're getting from the government. But still, they go about doing this all day, every day, when it's raining and even when it's sunny, without tiring. We've had situations where even in Elgeyo Marakwet, I remember a very sad story of a lady who was not able to access family planning methods. And so she had 9 babies, and it happened that by the time we were going there, she was supposed to be delivering her 10th baby, and she did not know how to fend for these kids. So she was actually brought to the facility and accompanied by the security personnel, the police, because she was trying to put cow dung and suffocate the child, because she does not know how to go about the process of providing for this child. So the messages that they're taking out there are messages that are changing lives. They may seem like messages, but we are also trying to ensure that they're able to provide services which are very responsive and which are very impactful. And so it would be our honor and our wish to bring more of the community health promoters here today so that we are able to hear from them. But unfortunately, we had to make do with our representation. And I would also wish to invite Josephine, who's a friend to HealthRight. She wears very many caps. She's a friend to HealthRight. She's a collaborator and a partner, and she's also a global public health specialist. And it would be injustice if we don't get to hear some of her insights, especially around the landscape, how her relationship has been and working with HealthRight through this journey, and her insights even as we move along with the important work that we are doing. Thank you so much.
Yeah, good evening, everybody. Yeah, as you've heard, my name is Josephine. I work for the Palladium Group. I'm currently a country team lead for one of the programs that is focusing on sexual reproductive health rights, working across 7 countries in Africa. I'm privileged, and it's a pleasure to be part of HealthRight today. And I think the first thing that I really want to start with is to just say, this is different. And I think I mentioned to Mwende there that other NGOs, organizations are shrinking and folding up, but HealthRight is in celebratory mood. So I think we need to clap. because it gives some life, it gives some hope that no matter the donor landscape, that there's still survival, isn't it? And I think for a lot of us, you know, this year has been a very different year for very many organizations, but it's a new life to just see like HealthRight is celebrating and going on, you know, and having other resources that can continue to support the communities. So for that, I think it's an exciting time. I think many rooms and boardrooms have sat. It has just been conversations, are we closing or not? But I think here it's a different conversation, so it turns how we see things, and it's a true testament of sustainability in its real sense. I think for me, I will share, of course, I'm with Palladium, and I have interacted with HealthRight under Palladium. But I think as an individual and in my career, I've interacted with HealthRight a bit longer and in different organizations. And I encountered HealthRight in 2016, the first time. And I think the person who I first saw was actually Hawa in a little office somewhere in Kangemi. And so when I sit here, I feel so proud that HealthRight is what it is today. That's just 9 years, actually. It's not even 10. And I remember I was working for IMA Well Health, and HealthRight was one of the partners that we were trying to give a grant to. And of course, we want to do the assessments for the organizations and the gaps so that we can see whether they can actually be able to deliver this scope. I think for that time, what gave us confidence is that there was a big brother in the US that would support this little office there with Hawa, and we are seeing Mwende in and out, and another director who followed, and he said, okay, there's a big brother, so we can kind of trust this one office, almost two-man show office, to deliver. And I don't think we were disappointed. And after that, I also interacted with HealthRight under the DECIP program, which we are all very proud of in terms of improving uptake of family planning, the prevalence in the very, very many counties that had a lot of challenges. And again, I remember then HealthRight had grown a little bit, and they had a bigger office. And I went to the office and I said, wow, now we are getting bigger. And we worked with them. We did a lot of support for capacity development on grants management, and the team grew. And again, now that time that I encountered HealthRight, we were looking, I was under Palladium, and we wanted to give grants to local organizations. But again, let me say I was very proud, because in that group of about 5 local organizations, HealthRight was the giant, because they seemed to have everything in place. The systems were working. When we asked for this HR manual, it's out there. When we ask for how do you manage your finances, they have M-Pesa system. You know, those several things that may not be there in local organizations. So we had a much easier time with the HealthRight compared to others. I think for HealthRight, we focused on things like revamp your website, speak a little bit more about yourself, let people know that you're existing. And again, we were not disappointed. So I think my journey with HealthRight is not just as giving the grants or working with organizations that are providing the grants, but actually it's the way you work, can I say, with a small sister or small brother, and actually see them grow and become big, and now they actually command respect in across the sector. The grant that we had last time with under Palladium called the NPI Expand, I remember even the donor USAID asked, I hope we will have HealthRight as part of the team. We are proud of that local organization. And we said, yes, we have shortlisted them. So we are very proud of that. So I would say that I have really seen HealthRight walk, crawl, walk, and now running. And I'm just surprised that, you know what, they want to climb Mount Kenya. Because while everybody else is wondering how deep this is, they're saying, oh, we are still going high. So congratulations to HealthRight. I think the other thing that I would say for HealthRight, and I think for other organizations, maybe the consistency in leadership and consistency with the faces. Maybe Peter can tell us later during tea how they have kept majority of the faces in that organizations. Silas, I think I've seen Silas for the longest time, and Hawa here, and Simba went and came back, and many other faces I'm seeing there. Judy, people have stayed on. What is this glue in HealthRight? Because one of the things that keeps organizations going is also retaining the people who hold the values for organizations, who are the face of the organizations, who believe in the organization and can be able to support its values, its beliefs, everything in the community, and keep that passion and the fire burning for that organization. So I think that really, Peter, there could be something you're doing differently, and maybe others need to know how some of the faces have really continued to surface and support this organization. So I would like to congratulate also the long-standing staff who have been there, around in supporting HealthRight Kenya. I think the last one, most of the people have talked about what has happened in the community. So I probably will not go so much into that because then would be repeating. But I think just feeling proud of what you've been able to achieve. I think Simba said something very important, that every 2 minutes we lose a mother. And that is huge. Because if you ask in this room, who knows someone who died or lost their lives while giving birth? I think literally everybody must be knowing a friend, a relative, somebody. Isn't that true? So it's a big thing. It's not just for statistics, but for ourselves as individuals. So if we have that opportunity to contribute to change that situation, to save that mother, so that those children can actually grow with a mother, and that man can also have a wife, all the sides we look at, and there can be that lady still an auntie to somebody and contribute to the community, we are making a big impact. So just very proud of the many, many things that HealthRight has done. And I think they have stamped their authority around community work. I think that's one of your biggest flagship in terms of implementation. We may not see you in health systems writing big policies, but when you go to the ground, we know HealthRight is in touch with the ground. So that's really a big one, and I can see you have not dropped that and you're continuing with it. So a big congratulations, and very proud and happy to be of support in whichever way. We may not have grants right now for the Palladium group, but who knows tomorrow? And of course, our go-to number one, and many others, of course, there's competition. I have to put that disclaimer so that I'm not disqualified from the selection team. But really, I think, you are an organization that has always made me proud as a person who makes decisions at the high level on who to onboard or not. So personally, I've not been disappointed. And also the organizations that have brought you on board have not been disappointed. Yes. So thank you very much.
Thank you so much to our panelists, Josephine, and the community beneficiaries. And I think the one thing that I'm getting from Josephine, even as she's speaking, is just how much we embody the values that we have as HealthRight. The community that we speak of, HealthRight Kenya is a community in itself. We really have each other's best interest at heart. And at the same time, we also, in as much as we're talking about system strengthening, we try as much as possible to continuously strengthen the system that is HealthRight. So the loyalty that you're hearing about the staff being here for over 10 years, 15 years, it is also a testament to the communities that we serve. I mean, who knows of any organization that has been in West Pokot since 2005? I think we're the only one. We go where the problem is and we stick there until the job is done. But we don't follow where the money is, but rather follow where the problem is. I mean, that's unique, right? So thank you so much. I wish to now hand over the session to Nina. But before then, maybe just to say thank you to our panelists.
Thank you so much, Madam Hawa, for that powerful session. Have we all learned something? Have we enjoyed the session? Let's give them another round of applause. DJ, give them something as they leave the stage. Right about now, we would like to get into the next session, which is Campus Conversation Reflections. This particular session will be led by the country director, Mr. Benson Simba. DJ, give him something as he comes on stage.
I almost said good night. I think it's almost good night, good people, but good evening. Good evening once again. Thank you so much for the team that just left the how do we call this? The stage. Thank you. Now, we want just to have a very quick reflection about engagement of young people on mental health. And we will not do a long session given the time is much fast spent. But 3 months ago, we launched a campaign on mental health targeting Kenyan universities. Now, when I was making my remarks, I did say that 1 in 4 Kenyans, right, will experience mental health issues at any one given time. So that's a very high prevalence that we are talking about. And we're getting so many cases from universities lately, and we said, why not reach out? Like just when said, we are not going to shy away from these problems. We'll get in and get to get solutions. So let me quickly ask Professor Kere to come up front. Quickly, Professor Kere, just come up front quickly. Mr. Ireri. So, Professor Kere, I've seen his CV. It's very long, about, is it 12 pages or whatever? It's such a long one, I cannot introduce him. He's the Dean of the School of Public Health, Moi University. Mr. Ireri, from the University of Nairobi, Dean of Students. Thank you, sir. And then, yes, Daktari, welcome. Welcome so much. Now, so I will give you 2 minutes each as we get to this. Sorry? Yes, sure. Thank you. Hawa seems to know what I needed. So thank you, Hawa. So we've been running that campaign with several universities. I know there are more universities that I represented here. I know there is Multimedia University here. I know there is Daystar University. Maybe for Daystar University, Dr. Wamale, we can just salute like this. I know we may not have a chance to get you to also speak. Multimedia University, I saw Helen somewhere. Yes, Helen from Multimedia University. And also, sorry, I've forgotten your name. Any other university that is present here, at least in this meeting, so that we don't forget? Yes, those are the universities that we had a chance to actually get them join us here today. So we launched this campaign, and we are at this point. I've also not seen Shadia. Where is Shadia? Shadia, please join me. Actually, this was your chair. Just come and join me as well. I don't want to leave you out. Yes. Shadia, you are from which university? University of Nairobi. Why are you not saying there? Yeah, thank you. I think I need another chair. So kindly, team, bear with me as I try to catch up with time, kindly. But I will want us to really, because we are getting towards the end of the session now, for you to just get a chance to listen in to what has been happening in the last 3 months, the mental health campaign within universities. And I will start with Shadia. If you are just to summarize the conversations, what are these pressures that university students have been struggling with in this time and era? Thank you.
Thank you for giving me this privilege to be able to speak up about and represent the university students on various mental health issues that have been have had such a strong bearing on us. We had an opportunity given to us by HealthRight a couple of months ago to be able to speak up and actively be participants in making the change and hearing from us directly as a youth on challenges that are impacting us. So some of the things we looked at was financial constraints, peer pressure and different peer settings. We looked at family situations, and we looked at so many other different effects of day-to-day lives that affect our mental health. And we thank you as HealthRight for giving us that opportunity to be active change makers in the society. Yeah.
Thank you so much, Shadia, for just doing 1 minute, trying to summarize so many things, because we've been having many dialogue sessions with the university students. If you check our website, YouTube link, social media platforms, you will see so many of those dialogue sessions happening. We have come up with a very good paper out of this, which we will be able to share with you later on. So because of time, we will not necessarily go into a lot of the many good things that came out of that. But I know, Professor Kere, you were part of this campaign from the beginning. So what are your reflections with these issues that are coming forward from universities from a solution point of view? Each of the lecturers here, just spending 2 minutes to speak forward from what you see opportunities and solutions to the many issues that young people have raised in the campaign that we were running.
Yeah, thank you very much, Benson Simba, the director of HealthRight Kenya, and of course the entire team that is here. So I was privileged to be part of the launch of the initiative by HealthRight to be able to engage the university students. That was really a landmark initiative, ideally because the cases that we really deal with at the university is not something that we could manage without partnering with other entities. Students go through a lot of issues. We in the university have structures that possibly had been earmarked to ensure that we could be able to provide the necessary support to students. But the dynamics have really changed. Circumstances do not allow or cannot facilitate the university to really deal with the many pressures that students go through. We have structures like offices of the deans of students, the counseling units that have been provided. And students, yes, would be able to go into those particular offices, meet the chaplaincy. But then the magnitude of the numbers of the cases that the students bring about, again, becomes a problem to those that are in those particular offices. But then the initiative that came through, where now we want students to be able to be inculcated to understand that challenges do exist, and of course they could be able to form peer groups, that they could be able to try to do counseling, is a good initiative. We have, again, the counseling sessions that have been provided within the university setup, ideally to be able to facilitate students to be able to find those spaces where they could be able to air out their grievances. But then we also feel that there is need for awareness, which again is brought about by this particular campaign, so that then we should be able to sensitize students some more about the issues to do with mental health. And I think one of the resolves that we have made is that we should be able to make mental health literacy a component that should be implemented to all possibly public universities, so that then when students are coming in, they should be able to be guided on these particular issues to do with mental health. We, of course, understand that it's not just the students that would suffer. We also have the staff, even within the university, that carry a lot of the burden. You know, every other time I meet up with people, they say, hey, you guys are now dancing in the streets with daras and stuff like that. Actually, you look at it, if these lecturers again would be able to sit by themselves, of course it would be able to cause a lot of problem, isn't it? So they are doing that ideally to air out their issues, give support to each other. Yeah, so anyway, I can say that what we need to do and what we intend to do is to ensure that we have a common course inculcated within our university to be able to ensure that students are guided, they are trained, their capacity built on how they could be able to deal with mental issues. Otherwise, it's a big, big problem. I think that's what I can say. Today, I think in the morning at 8, I was having a call with an entity in Sweden, Linköping University, but then talking to the in charge of the national capacity building. Okay, there's an entity there that deals with issues to do with children, gender-based violence, and of course issues to do with mental health. And some of the things that they were telling us is that they already have some infrastructure that they could be able to share out with us. So the element of doing the short call, the common course can easily come through. And that would be an online course, maybe, to be able to be onboarded to students. So we will be able to partner, and I like the synergy that has come in, so that then within the university we have partnered with non-government organizations, government, of course, I could see they are brought in, so that then we could be able to work out these things together. I think that is also very vital. Thank you.
Can we appreciate Prof? So thank you, Prof. So Mr. Ireri, the University of Nairobi, I'm very careful. The University of Nairobi. So what do you see as solutions? We know what the problems are. We know what the young people are struggling with. What do you see as, in 2 minutes, what do you see as the solutions?
Thank you very much. First, let me recognize my former boss and still my boss, George Awara, who was my boss before I moved to the university. He still is. I've also come with one Gen Z 5th year medical student who is helping me in mental health, Ongeri. Thank you very much for the opportunity. Shadi has expressed all the problems our students are going through in the universities, brought by academic pressures, missing mark, retake, receipts, and all that, financial, new funding models, an ability to balance between relationship, family broken at home, between mother, father, all those issues lie in our office. So to go forward, we have come up with a deliberate effort, a strategic model that we hope that it will minimize the issues of mental health challenges. One, we have established a safe space together with the UNESCO O3+ program, which is looking at safe spaces outside classroom where students can have mini discussions outside classroom to discuss the issues, and it's working already. We also have an established student wellness center. We have piloted in the main campus. We have 14 campuses, so we still have a long way to go in other 13 campuses. The third one is strengthening the student counselor ability to cope with the mental health challenges through training and various professional engagement with the psychologists of Kenya. And the fourth one is peer counselors model. So it's a four-pronged strategy that we have come up with, and we have also made a deliberate effort to mainstream mental health in every of the program. Any student activities we do, whether with the student leaders, whether with the professors, whether those counselors, we've made a deliberate effort to mainstream mental health issues. If it's a lecturer, we want to repackage them that before even they release the marks for the medical school or engineering, which is a bit affected because of the course they do, we do have a model of where we counsel debrief and all that. And if it is classroom, before a lecturer do the classroom delivery, they can have a pilot briefly. How are you feeling today? Do you feel like you're overwhelmed? Would you like to see a counselor? There is a wellness center just across. The dean of students is there. The assistant, we are there because it takes a village to raise a student. To raise a child. So don't die with your problems. Such kind of things. Then drug and substance has become a menace, particularly in the University of Nairobi. Being a hub in the city, but we are working with NACADA, the police agencies. We are working with multi-government agencies to spruce up the area because it has also contributed to what somebody said. It makes you retarded mentally, and before you know it, somebody has turned to another big thing. So I was with the PS Omoro 2 days ago, and we have an elaborate plan on how to deal with the drug and substance menace around the university. Thank you.
Thank you so much. Let's appreciate Mr. Ireri. Dr. Kathula, also in 2 minutes, your reflections on the same question.
Okay. We cannot bury our heads. We know where our students are. And some of when they come to university, some of them just do things like adventuring. So for our university management, University of Africa, we have realized most of the problem is usually the coupling and the marriaging they are having within themselves. And what we have noted that when girls become pregnant, the boys are the ones to take care of the children when the girls are coming to class. And through that, you find absenteeism is very high. So as a university, what we have done, when we admit students, we give student mentors, and these mentors, they are supposed to meet with their group probably twice in a month, and they do a report. For the issue of sexual activities, we have guidance and counseling, and we have our medical centers within the university. So what we have done, we ensure that at the window of the medical center, condoms are free. And we tell them, if you cannot abstain, please use condom. You are not only preventing the issue of pregnancy, but you are protecting yourself from HIV and AIDS and other diseases. Then in our university, attendance of classes are must, and it is not just signing. We have admin who go around to ensure that a lecturer is in class and the number of the student in class. And usually monitored if you miss 2 consecutive, because you're not supposed to miss to less than 85% class attendance, you're not supposed to do exam. So through this attendance, which is shared with the management, every day I get a sheet telling the teacher and the number of the student. So if we monitor a student frequently is not attending class, we engage that student through counseling section. And if it doesn't change, we tell the student, let us inform your parent. And most of them, since they don't want their parents to know, they just reform and start doing the right thing. Thank you.
Thank you very much. Let's appreciate Dr. Kathula. So thank you so much for your insights around the issue of mental health, focusing on the universities, and the many dynamics that you have been able to bring out. I think to your last point, I think there is the whole involvement, the whole issue of involving parents as part of the solution. So, which is a very important point as well, just like all the others. So, again, like I said, there have been a lot of dialogue focusing on university students. We do have a report which we will be able to share at a later stage. But just want to appreciate all the universities that have been partnering with us, even those who are not here. I think Technical University of Mombasa is also one of them, to handle this a bit. And so we'll continue having this conversation in the coming days to seek solutions, so that for us, as we said in our university, it's not just any other statistics, but it's a life that we have to ensure that we don't have such cases getting to happen. Thank you so much for listening to us, MC. Thank you.
Thank you so much, Mr. Benson Simba, for moderating the campus conversation reflections. Right about now, I'd like to invite the spoken word artist, our spoken word artist for the night. DJ, give him something as he gets on the stage. A round of applause as he gets on stage. I don't want to call you a spoken word artist. So what is your name?
Hello everyone, my name is Roba, also known as Roba is here, also known as for today the spoken word artist. I'm a poet, and I observe this society and I write a lot. When I'm not doing poetry, I'm the current vice chair of the Youth for Mental Health Consortium, which is a consortium of youth-led organizations on mental health in Kenya. Today we just had the conclusion of the second National Mental Health Conference, and tomorrow we are doing the World Mental Health Day in collaboration with the Division of Mental Health and other partners. I'm happy to be here, and congratulations to HealthRight for the 20 years. I'll just go quick. To be honest, I'm a bit anxious, but I'll go just quick straight to my performance. Just a small icebreaker. No, I'm not going to ask any of you to dance, but I'll ask you to help me count. It's just a small counting exercise. So, mgonjwa amelala fofofo, comma 3-3, heart in a beat 2-2, lines za 911 hazifanyi, ni emergency, inahitaji urgency. Kufika hospitalini, daktari ndio patient, hana haraka, anamtizama kwa macho 4 kwa muda wa masaa 3, ati ngoja dakika 2, nitakuhudumia mara moja. Nice, welcome. So the next piece, which is the final and presentations I'll do. I was also in Technical University of Mombasa. One day I'm in class. I'm called by my neighbors, who was my roommate. I'm told that, hey, your roommate ameonekana akitembea uchi kwa streets. So the following piece is written as an observation to that and what HealthRight is doing in terms of access and talking about mental health is important. Thank you, welcome, and yeah. Wanita crazy na we si daktari, ukinita crazy nitakudunga msumari. Silence. Silence like the room that they've locked up me in. Silence. Silence like when they mention my name. Silence. Silence like when they see me out there in the streets. Silence. Amechizi, amerukwa na akili, he's gone nuts, ametolewa kiti, ni mwendo wazimu. Silence. I listen to them as they speak. I watch as they move away. I follow their commands. Like a dog tied to its kennel, I'm chained up in my own bed, a prisoner in my own home, a familiar stranger to all those who knew me, a wanderer in the same very streets that I grew up in. Silence, amechizi, amerukwa na akili, he's gone nuts, ametolewa kiti, ni mwendo azimu. I listen, I watch, I follow, as they follow their cultural practices and beliefs that are embroidered in their hearts, tailored in their brains. To them, mental disorder is not an illness, it's rather an ill, a punishment from the gods, a curse from the ancestors, bahati mbaya kwa familia, the presence of evil spirits, demons, and as a result, I'm chained up, locked up, forgotten. Sometimes my female companions are taken advantage of, ripped off by their innocence by people who claim to be seen. You see, sometimes they take us to shackles or spiritual dens where they do all manner of madness and practices on us. Sometimes I wonder which doctor will save us from the witch doctors. Which doctor will save us from the witch doctors. But such times, manze, I'm too traumatized to speak. I feel so afraid and lonely. And according to them, simi nimechizi, simi nimerukwa na akili. So nipate nikifanya maneno yangu, nipate nikirarua makaratasi, because they contain the pages of my life that already lost meaning. Sometimes in the streets, they stare at me with amusement. They smile, they laugh, chekule cheesy, and slowly turn away. But wait, mister, wait, miss, how did I get here in the first place? I may be schizophrenic, I may be bipolar, I may be bulimic, but such terms are new to this continent. I won't blame you, because for the common mwananchi, it's an African. It's an African to have a mental disorder. Yes, you ugonjwa, ni uchawi, jogi, ndoka. And yet 5% of Africans suffer from mental-related illness. In Kenya, 20 to 40% of the outpatients fall under this bracket, and yet 40% of them are unaware. The same unawareness that sometimes stands in our health sector, with sometimes with poor facility ratio. Sometimes we wonder, which doctor will save us from the witch doctors? Thank you so much.
So ladies and gentlemen, have you enjoyed the evening? I can't hear people saying yes. Are you guys enjoying the evening? Are you learning something? What have you learned? Yes. Yeah, you've learned a yes. That's amazing, yeah?
So it's been an amazing night. As we are signing out, I'd like to invite the country director, Mr. Benson Simba. He will take us straight into the launch of the Minds in Motion project. So thank you so much for having us tonight. We have enjoyed your time. We have enjoyed the crowd. I have been your host, MC Wangare.
Alongside MC Tony.
Thank you so much and have an amazing... Now continue inviting us for your jobs. We hope to entertain you a little bit more.
Thank you. Thank you, our MCs. We really appreciate you. Peter, let me ask you to just come up front, kindly. In the journey that we have had as HealthRight, for sure it was never easy, but there are people, so many people, like we said, who made it possible for us to be where we are. And one of them is Gladys Mwende, who was our founding country director. And Gladys, kindly come up front, and you receive this appreciation from, yes, our CEO, for the good work that you did, for believing in the dream and the vision, and supporting the organization in those early days until we are where we are today. Thank you so much, Gladys. So, Stella, you're very special to us. Now, Stella, you might mistake her for being a HealthRight colleague, but she's really, truly government, the head of mental health in Nairobi County Government. So we thank you for the support that you have given our teams as they did implement the work for all these years. Thank you so much. Thank you. You can have a seat, Peter. Let me now ask Dr. Wamalwa, please come up front. Dr. Wamalwa from Daystar University. As we do all that we do, the community is at the center of it. And therefore, stories of inspiration that change lives, like the ones of RISPA, are really important. So RISPA, kindly come. Quickly get followed by Dennis Otieno. Also, the great champions who have been championing the work for several years, supporting other community members. Yeah, he's going to give you. Okay, Dr. Thank you very much. Thank you, Dr. You can now sit. For this last batch, I will ask Dr. Regeru to just come. Now, Dr. Regeru, this team is very special to us that now we are talking about. I want you, Dr. to start with a colleague of ours who has worked for the organization for, is it 19 years? Where are you? Even if I don't say your name, just come. Close to 19 years, just come. Helen Chemtai. Thank you. The next colleague is Hawa Abdullahi, the longest serving staff members. The longest serving staff members. Thank you very much. Silas Chabon is the last one, who has also done more than 10 years, and we're still counting, I think. Thank you very much. I now want to call, maybe Dr. Regeru, you should be the first one. Let me just find the easiest way to harass you today, only today. Thank you. Let me ask the following to also come up front, the university or university representatives that came here today, who have been with us in the MIM initiative. Please come. All universities, I'm talking about University of Nairobi, kindly. Where is Mr. Ireri? Please come here. Prof, please kindly come here. Kenya Red Cross, the partners who have been part of the campaign. Please come forward. I've actually been looking for you. Thank you, you're here, okay. Which university is missing here? Dr. Amalo, please be here. Yes. Peter, kindly also come up front. Just come. Stella, kindly join us. Wilson, you need to give guidance.
So ladies and gentlemen, this is a very important moment when you're launching our Minds in Motion initiative. So it's going to be very simple. We're going to do a countdown, and then all the special guests here, we're going to cut the tape. Our country director, you're going to be in the middle, together with the CEO International, HealthRight International. You're going to come this side. You come to this side. And then, then Mr. Ireri, you're going to come there. Yeah, and then all of us are going to be on the side, and then you're going to cut the tape, all right? So we are going to launch. So we do the countdown, and then you're going to help us. You're going to help us. Yes. Thank you. Don't have it. Thank you very much. And then you're going to do a countdown. Okay, and then the rest of us are going to support and cheer, okay? Are we ready? Are we ready? Say ahu. Okay, thank you very much. DJ, are you ready? Are you ready? In.
Audio Jungle.
Thank you very much. So again, we have the team. Again, we have the team. Just move around the cake. Let's just cut the cake. Yeah, just come. Join the team. Let's cut the cake. Yeah. Yeah. Pick our cake. Yeah. Let's just make a nice cup. Yeah. So Stella, you're going to guide this process. Thank you very much for being part of us. This is going to make a nice cup so that you, that way. Thank you. Thank you. Sorry. Yeah. Are we together? All right. Let's go. DJ, let's go. Are you happy? You're gonna share a piece with everybody. You're gonna share pieces with everybody, and then you're going to close. Everybody just have a fork, have a piece. It will be a good representation of everybody.
It might seem crazy what I'm about to say. If you feel like happiness is the truth, because I'm happy. Clap along if you know what happiness is to you, because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Yeah. Well, give me all you got and don't hold it back. Yeah. Well, I should probably warn you, I'll be just fine. Yeah. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do.
Thank you. Okay, the cake is coming your way. I know there are some people, if they miss the cake, it will be a big thing. Good evening, everyone. My name's Reverend Dr. Jaconia Musembi. I'm board member of HealthRight Kenya and the board treasurer stand here to make a remark and bring us the vote of thanks. So I want to say that as we come to the close of this beautiful celebration, I'm filled with pride and gratitude for the entire event. And this on behalf of the board. This is a testimony of great things that have happened. Just a moment. As we celebrate those 20 years of vision and voice, those are 2 decades of commitment, of great courage, and of compassion that has gone out in this country. HealthRight Kenya has had a journey that has been characterized by partnerships and the purpose that has brought us this far. This journey has brought transformation to lives, empowering of communities, and ensuring that health is a right and not a privilege to any person in the country. From our work in maternal health, mental health, HIV, and the rest of the areas that we have been serving, we have seen what is possible when people come together with a shared vision. As a board member, as I've said, I've witnessed firsthand the resilience, innovation, and integrity that define the organization that HealthRight Kenya is. The past few years have obviously been feasted with a bit of challenges. This year and last year, probably bringing it to a very high level with the reduction of support from obvious corners. But the unwavering support of our partners and donors and the trust of the communities that we serve has kept us going, and we are grateful. Allow me at this point to extend heartfelt appreciation to everyone who has made today's celebration possible through the contributions that have gone into this for the 20 years, including our staff that somebody said we have known how to keep them and they have not been leaving. Well, that is part of the reason that we are here today. Our organizing team, the staff, board members, alumni, partners, friends, and everyone that has been able to come today, we are grateful. To our founders and those who paved the way, like Peter Navario, we stand on your shoulders with very deep respect, and we thank God for you. As we look to the next 20 years, which we will celebrate again before we celebrate the Jubilee, I pray may we continue to lead with the vision, speak with the voice, and act with heart. Together, we will make health and human rights a reality to all. So thank you all, and congratulations to HealthRight Kenya on this remarkable milestone. And with that, our celebration comes to a close, and we are invited for refreshments. Thank you very much again. The Lord God bless you.
Amenivua vazi la aibu na moyo wangu wakati sina budi
HealthRight is an organization that is based here in Nairobi but working across the country, and our focus is really expanding quality health care services to the marginalized communities.
Founded in 2005 in West Pokot, we began with a bold vision and an even bolder action, launching a pioneering HIV program that led to a staggering 1,000% increase in HIV testing across West Pokot and neighboring counties.
We really focus around ensuring that we reduce the gap in terms of health access between the general population and also the marginalized communities. And we have actually been working across 11 counties, focusing on a number of key thematic areas. One, reproductive, maternal, neonatal and child health, RMNCAH. We have also had programs in other thematic areas such as HIV and TB programming. We've done work around violence prevention, especially sexual gender-based violence. We've also have a thematic work around mental health across the areas where we have been working.
It has been an amazing journey working with HealthRight Kenya, starting from the initial project when they joined the mental health space. And our first project was a very amazing project because it was an area that has hardly been navigated through or have projects going on. That was on perinatal mental health, and this was happening in the informal settlements. So when you look at it, they are addressing an area that is neglected, and again focusing on women from the informal settlements, where we had amazing success stories from this project, and we were addressing depressive symptoms among pregnant and breastfeeding women.
Story yangu ilianza wakati mzee wangu alipoteza kazi, na mimi pia nilikuwa na mimba. Nilipata challenge mingi sana kwa sababu nilishindwa kulipa rent, school fees, na saa zingine pia kupata chakula ilikuwa ngumu. Na wakati mtu uko kwa situation kama hiyo, marafiki huwa wanatoroka, family members, unabaki peke yako. Nilikuwa najifungia kwa nyumba kwa sababu singetoka hata kwa majirani, kwa marafiki, sababu ya ile uoga, wanakusengenya, wanakuongea vibaya. Na si kujua kama na go through mental issues. Mpaka ule wakati HealthRight Kenya waliweza kukuja wakanitembelea, but mara ya kwanza nilikuwa naogopa ku-open up, kuambia what I'm going through. Wakakuja mara ya kwanza, ya pili, ya tatu, sasa ndio nilifunguka nikawaelezea, but walinipa tumaini na wakanipeleka through 10 sessions zenye ziliweza kunisaidia, na through those sessions niliweza kupata skills na nikajua kwamba hata kama mzee alipoteza kazi, bado kama mimi mwanamke naweza jituma na niweze kusimamisha familia yangu. Mimi nilianza kuenda kwa nyumba, nikafikiria, nikaona naweza anza kufanya nini ndio nijitoe kwa hii situation. Nikaanza biashara ya kuuza makaa, kuuza chapati, na nikaweza kuanza kulipa bills, watoto wakarudi shule, pia tukaanza kupata hata chakula. Currently I have an electronic shop. Pia niliweza kuhama kutoka kwa slum, saa hii nakaa nyumba mzuri. Nashukuru sana HealthRight Kenya, wamenitoa mbali, bila wao sijui saa hii ningekuwa wapi.
One of the key things that I must say is about the uniqueness of the work that we do, you know, as an organization. We truly, you know, focused at the community, and we're really very keen around evidence-based interventions. As an organization, we co-create solutions with our communities to come up with key evidence that does inform the programming work that we have been doing for the last 20 years.
In our county, the challenge has been poor health-seeking behavior among men. We really appreciate that when HealthRight came, their focus was on this target population, which is men, because of their poor health-seeking behavior. And over time, we've seen increase in numbers of men who are coming on forth to seek for services, especially HIV test services. We really appreciate that in 2022, when testing services was integrated with mental health, we saw the community benefiting from mental health screening and referrals. We saw uptake of men coming in for seeking services, especially HIV test services, and those who are at risk being put on HIV prevention interventions, those who are found to be HIV positive being linked to care and supported through mental health integration, through psychosocial supports. And we really appreciate that this became a game changer in terms of HIV programming in the county and finding men and adolescents.
Naweza penda hii mpango iendelee na isiweze ikituachilia sisi takuwa ni kama tumeisha. Kwa maana tunapewa vitu paka kwa mlango kwenyewe. Imetusaidia sana. Wanabodaboda wenzangu nawaambia tuendelee kushikilia hapo na tusiendelee kutoka nje sana bila mpira, na ndio hii shirika limekuja paka karibu inatupigania paka hapa kwa mlango. Sasa tusiweze kutoka nje bila mpira.
HealthRight Kenya is a very unique organization in the sense that the rights issues around equity, reaching out to people who have not been reached, creating health justice with its programming is the main thing that it does, especially in the areas of mental health, which is currently a very big issue in the whole country and in the continent and even in the world. A very neglected area of care is what HealthRight does. In addition, maternal health, sexual reproductive health, all the issues around non-communicable and communicable diseases, which remain a big challenge in our region, are some of the issues that HealthRight Kenya is tackling.
Andres, umekuja unasaidia sisi kabisa. Unajua vile kazi ya kina mama, anapeleka klini, napeleka tena mpaka nafuata mpaka napeleka hospitali. Mikindo hiyo shindomon abana mwanamke anasaa kwa nyumbani, anasaa kwa hospitali. Anaambia Andres asanti, na sisi anaona mabadiliko sana sana sana. Tangu akuje nasaidia sisi kabisa.
Appreciate HealthRight Kenya for what they have done in our county from the time we started partnering up to now. They have really impacted us in a lot of things that we have been able to benefit a lot. They have been able to train our health workers, and they have mentored them to have skills. And our community health promoters, they have also helped us in training them and providing them with knowledge and information so that they are able to help our community right from our villages.
To this end, as an organization, we have been able to impact more than 4 million Kenyans across the 11 counties over the 20 years that we have actually worked. We take pride and we are really happy about the innovations, life-changing innovations that we have really seen across all our programs. When it comes to the sexual reproductive health space, we have also had very useful innovations. We did work funded by FCDO in Elgeyo Marakwet and West Pokot. The contraceptive prevalence rate in those counties was very low, as it were. But we had to come up with innovations such as male involvement, ensuring that we are doing social inclusion, innovations that ensured that we can penetrate certain cultural barriers and also address challenges both on the demand side and on the supply side to ensure that we can improve family planning in those counties.
Hapo mwanzo ilikuwa community ikisikia maneno ya family planning walikuwa wanaona ni kitu jambo hatari sana. Wanachukua kama family planning inaleta kanza, inaleta wamama kutokuzaa. Lakini baada ya HealthRight kukuja, tuliweza kupata hiyo information ambayo ilitusaidia, tukapeleka kijijini, kijiji waliweza kubenefit. Kwa sababu tuliweza kuwa na link nao kwa karibu, hiyo services ikafika kwa community. Of which tukakuwa trusted sana. Kwa sababu kuna wamama ambayo walikuwa wakienda na hofu, wasee wao hawakuwa nakubali maneno ya family planning, lakini baada ya sisi kupeleka hiyo information kuwa family planning haileti cancer, family planning haisuii wao kupata watoto. Inafanya nini? Inafanya tu child spacing. Mtu anaweza kupata watoto ambaye anahitaji ama anapata mtoto kwa muda fulani.
Wamama wamerelax, alafu pia wanazaa kwa mpango ulio mzuri. Maana hapa awali kabla wajue, mama alikuwa anazaa baada ya mwaka. Sasa afya mama inadhoofika, hata watoto ambao wanazaliwa pia hawana afya ile nzuri. Lakini sasa hivi baada ya miaka 3 ama 5, bila shaka yule mtoto akizaliwa, yule mwingine amekuwa mkubwa, afya mama naye ni safi. So kutokana haya mafundisho ambayo tulipata kwa HealthRight, mimi kama kanisa nilisaidika sana, na jamii wengi wamekuwa kipongeza na hata wanaulizia haya mafundisho yameenda wapi.
And it's so amazing these days when you go for support supervision and you find a community health promoter who is running these interpersonal therapy groups without being paid, and that shows that from what they did, there's a big aspect of sustainability.
I recall when we started with HealthRights way back 2018, 2017, when we were doing less than 40% prevalence for family planning services. But when HealthRights exited by the year 2022 to early 2023, our performance stood at 59% coverage for family planning contraceptive services in this county.
As we look ahead, we recommit to our core values: innovation, equity, and a human-centered approach, all in the pursuit of increasing access to care and increasing care quality.
I really wish to thank all the many partners. I celebrate the community health workers we work with. I celebrate the youth and the champions in universities that we have been working with. I celebrate the HealthRight staff who are the front line when it comes to programming within the organization. I appreciate the support we receive from our headquarters. Thank you, universities, for trusting to work with us to get solutions to the challenges affecting young people as well. To the Minister of Health, we also say thank you for creating an enabling policy environment for us to be able to roll out quality interventions that can be able to address public health challenges in this country. And for the county governments for being with us there during implementation, providing the technical support, we really appreciate that kind of invaluable support. To our partners, we'll continue working together, and everyone else that has really made these 20 years worthwhile. And last but not least, it's the funding community and our donors. Without the financial support that you gave us, donors such as USAID, FCDO, Gilead, Comic Relief, and several others such as Amplify Change that I may not mention all their names. Thank you so much for your financial support that came our way and enabled us to be able to support the lives of millions of Kenyans in terms of accessing quality health care. Thank you so much. HealthRight is an organization that is based here in Nairobi but working across the country, and our focus is really expanding quality health care services to the marginalized communities.
Founded in 2005 in West Pokot, we began with a bold vision and an even bolder action, launching a pioneering HIV program that led to a staggering 1,000% increase in HIV testing across West Pokot and neighboring counties.
We really focus around ensuring that we reduce the gap in terms of health access between the general population and also the marginalized communities. And we have actually been working across 11 counties, focusing on a number of key thematic areas. One, reproductive, maternal, neonatal and child health, RMNCAH. We have also had programs in other thematic areas such as HIV and TB programming. We've done work around violence prevention, especially sexual gender-based violence. We've also have a thematic work around mental health across the areas where we have been working.
It has been an amazing journey working with HealthRight Kenya, starting from the initial project when they joined the mental health space. And our first project was a very amazing project because it was an area that has hardly been navigated through or have projects going on. That was on perinatal mental health, and this was happening in the informal settlements. So when you look at it, they are addressing an area that is neglected, and again focusing on women from the informal settlements, where we had amazing success stories from this project, and we were addressing depressive symptoms among pregnant and breastfeeding women.
Story yangu ilianza wakati mzee wangu alipoteza kazi, na mimi pia nilikuwa na mimba. Nilipata challenge mingi sana kwa sababu nilishindwa kulipa rent, school fees, na saa zingine pia kupata chakula ilikuwa ngumu. Na wakati mtu uko kwa situation kama hiyo, marafiki wao wanatoroka, family members, unabaki peke yako. Nilikuwa najifungia kwa nyumba kwa sababu singetoka hata kwa majirani, kwa marafiki, sababu ya ile uoga, wanakusengenya, wanakuongea vibaya. Na sikujua kama na go through mental issues. Mpaka ule wakati HealthRight Kenya waliweza kukuja wakanitembelea, but mara ya kwanza nilikuwa naogopa open up kuambia what I'm going through. Wakakuja mara ya kwanza, ya pili, ya tatu, sasa ndio nilifunguka nikawaelezea, but walinipa tumaini na wakanipeleka through 10 sessions zenye ziliweza kunisaidia, na through those sessions niliweza kupata skills na nikajua kwamba hata kama mzee alipoteza kazi, bado kama mimi mwanamke naweza jituma na niweze kusimamisha familia yangu. Mimi nilianza kuenda kwa nyumba, nikafikiria, nikaona naweza anza kufanya nini ndio nijitoe kwa hii situation. Nikaanza biashara ya kuuza makaa, kuuza chapati, na nikaweza kuanza kulipa bills, watoto wakarudi shule, pia tukaanza kupata hata chakula. Currently I have an electronic shop. Pia niliweza kuhama kutoka kwa Salamu, saa hii nakaa nyumba mzuri. Nashukuru sana HealthRight Kenya, wamenitoa mbali, bila wao sijui saa hii ningekuwa wapi.
One of the key things that I must say is about the uniqueness of the work that we do, as an organization. we truly, focused at the community. And we're really very keen around evidence-based interventions. As an organization, we co-create solutions with our communities to come up with key evidence that does inform the programming work that we have been doing for the last 20 years.
In our county, the challenge has been poor health-seeking behavior among men. We really appreciate that when HealthRight came, their focus was on this target population, which is men, because of their poor health-seeking behavior. And over time, we've seen increase in numbers of men who are coming on forward to seek for services, especially HIV test services. We really appreciate that in 2022, when testing services was integrated with mental health, we saw the community benefiting from mental health screening and referrals. We saw uptake of men coming in for seeking services, especially HIV test services, and those who are at risk being put on HIV prevention interventions, those who are found to be HIV positive being linked to care and supported through mental health integration, through psychosocial supports. And we really appreciate that this became a game changer in terms of HIV programming in the county and finding men and adolescents.
Naweza penda hii mpango iendelee na isiweze ikituachilia sisi takuwa ni kama tumeisha. Kwa maana tunapewa vitu paka kwa mlango kwenyewe. Imetusaidia sana. Wanabodaboda wenzangu nawaambia tuendelee kushikilia hapo na tusiendelee kutoka nje sana bila mpira, na ndio hii shirika limekuja paka karibu inatupigania paka hapo kwa mlango. Sasa tusiweze kutoka nje bila mpira.
HealthRight Kenya is a very unique organization in the sense that the rights issues around equity, reaching out to people who have not been reached, creating health justice with its programming is the main thing that it does, especially in the areas of mental health, which is currently a very big issue in the whole country and in the continent and even in the world. A very neglected area of care is what HealthRight does. In addition, maternal health, sexual reproductive health, all the issues around non-communicable and communicable diseases, which remain a big challenge in our region, are some of the issues that HealthRight Kenya is tackling.
Andres, umekuja unasaidia sisi kabisa. Unajua vile kasi ya kina mama, anapeleka klini, anapeleka tena mpaka nafuata mpaka anapeleka hospitali. Mikindo hiyo shindomon abana mwanamke anasaa kwa nyumbani, anasaa kwa hospitali. Anaambia Andres, asanti. Na sisi anawana mabadiliko sana sana sana. Tangu akuje nasaidia sisi kabisa.
Appreciate HealthRight Kenya for what they have done in our county from the time we started partnering up to now. They have really impacted us in a lot of things that we have been able to benefit a lot. They have been able to train our health workers, and they have mentored them to have skills. And our community health promoters, they have also helped us in training them and providing them with knowledge and information so that they are able to help our community right from our villages.
To this end, as an organization, we have been able to impact more than 4 million Kenyans across the 11 counties over the 20 years that we have actually worked. We take pride and we're really happy about the innovations, life-changing innovations that we have really seen across all our programs. When it comes to the sexual reproductive health space, we have also had very useful innovations. We did work funded by FCDO in Elgeyo Marakwet and West Pokot. The contraceptive prevalence rate in those counties was very low, as it were. But we had to come up with innovations such as male involvement, ensuring that we are doing social inclusion, innovations that ensured that we can penetrate certain cultural barriers and also address challenges both on the demand side and on the supply side to ensure that we can improve family planning in those counties.
Hapo mwanzo ilikuwa community ikisikia maneno ya family planning walikuwa wanaona ni kitu jambo hatari sana. Wanachukua kama family planning inaleta kansa, inaleta wamama kutokuzaa. Lakini baada ya HealthRight kukuja, tuliweza kupata hiyo information ambayo ilitusaidia, tukapeleka kijijini, kijiji waliweza kubenefit kwa sababu tuliweza kuwa na link nao kwa karibu, hiyo services ikafika kwa community, of which tukakuwa trusted sana kwa sababu kuna wamama ambayo walikuwa wakienda na hofu, wasee wao hawakuwa nakubali maneno ya family planning. Lakini baada ya sisi kupeleka hiyo information kuwa family planning haileti cancer, family planning haisuii wao kupata watoto, inafanya nini? Inafanya tu child spacing. Mtu anaweza kupata watoto ambaye anahitaji ama anapata mtoto kwa muda fulani.
Wamama wamerelax, alafu pia wanazaa kwa mpango ulio mzuri. Maana hapa awali kabla wajue, mama alikuwa anazaa baada ya mwaka. Sasa afya mama inadhoofika, hata watoto ambao wanazaliwa pia hawana afya ile nzuri. Lakini sasa hivi baada ya miaka 3 ama 5, bila shaka yule mtoto akizaliwa, yule mwingine amekuwa mkubwa, afya mama naye ni safi. So kutokana haya mafundisho ambayo tulipata kwa HealthRight, mimi kama kanisa nilisaidika sana, na jamii wengi wamekuwa kipongeza na hata wanaulizia haya mafundisho yameenda wapi.
And it's so amazing these days when you go for support supervision and you find a community health promoter who is running these interpersonal therapy groups without being paid, and that shows that from what they did, there's a big aspect of sustainability.
I recall when we started with HealthRight way back 2018, 2017, when we were doing less than 40% prevalence for family planning services. But when HealthRight exited by the year 2022 to early 2023, our performance stood at 59% coverage for family planning contraceptive services in this county.
As we look ahead, we recommit to our core values: innovation, equity, and a human-centered approach, all in the pursuit of increasing access to care and increasing care quality.
I really wish to thank all the many partners. I celebrate the community health workers we work with. I celebrate the youth and the champions in universities that we have been working with. I celebrate the HealthRight staff who are the front line when it comes to programming within the organization. I appreciate the support we receive from our headquarters. Thank you, universities, for trusting to work with us to get solutions to the challenges affecting young people as well. To the Minister of Health, we also say thank you for creating an enabling policy environment for us to be able to roll out quality interventions that can be able to address public health challenges in this country. And for the county governments for being with us there during implementation, providing the technical support. We really appreciate that kind of invaluable support. To our partners, we'll continue working together, and everyone else that has really made these 20 years worthwhile. And last but not least, it's the funding community and our donors. Without the financial support that you gave us, donors such as USAID, FCDO, Gilead, Comic Relief, and several others such as Amplify Change that I may not mention all their names. Thank you so much for your financial support that came our way and enabled us to be able to support the lives of millions of Kenyans in terms of accessing quality health care. Thank you so much.
Audio